Welcome to the Great Lakes Health radio program. I'm your host, Francesca Messiah from Kaleida Health. At Kaleida Health, we see people and not just patients. Our topic for today, we will be talking about the Da Vinci robotic surgery for prostate cancer. This is an important topic, especially for men and for families who might be having surgery. And you have questions about your friend might be having surgery, someone in your family might be having surgery, or someone who's been recently diagnosed with prostate cancer that requires surgery. And someone may have mentioned this robot called the Da Vinci. And you might be saying, what is this? Well, you know what? Today we have an expert with us from Buffalo, and our guest for today is Dr. John Rutkowski. Good morning, Dr. Rutkowski.
Good afternoon, friend.
Good afternoon. I know, I keep saying good morning. It's morning somewhere. And Dr. Rutkowski is a surgeon at the Western New York Cancer Care as well as Western New York Urology. Also our guest for today, we have two guests today, Denise Mecca, and Denise is a nurse and patient advocate, correct?
Yes, I am.
And also at the Western New York Cancer Center and Cancer Care Center and Western New York Urology. Well, good afternoon to both.
Thank you.
Good afternoon, friend.
Thank you.
And let's begin. And I think, Denise, you were going to add a little more, because I know before the show we were talking about Dr. Rutkowski's credentials, and you were going to tell me why he's so special.
Oh, he's very special in many ways. Dr. Rutkowski is... he has a fellowship in robotic surgery, and a lot of other doctors don't have that. He was specially trained at the Cleveland Clinic, did an extra training specifically in robotic surgery, and he has extra credentials some other robotic surgeons don't have. And that's important to note because many, many doctors out there don't have that.
And gives comfort to the family. And while we're on that topic, Doctor, could you please talk a little bit about what is robotic surgery?
Sure. Denise, thank you for that kind introduction. Robotic surgery is one of my passions. There's a lot of misinformation, Fran, about robotic surgery, but if I can explain it a little bit, robotic surgery is a type of minimally invasive surgery. So it allows the surgeon to do really complex surgeries through small incisions. So typically a number of small ports are introduced into the abdomen. Then we insufflate the abdomen with carbon dioxide gas so we have room to work. And then we attach a machine, the robot, the Da Vinci robot, to those ports. And it's typically 4 arms. And we can put in instruments through those ports, and that allows us to do the entire work that we need to do through these small incisions.
And now, through all that, is the patient asleep?
So yes, the patient is completely asleep. Okay. They're paralyzed. They cannot move. They cannot wake up. And then we get to work. We put them to sleep, and then we introduce the ports, and then we hook up this machine. The robot is an actual machine. However, the surgeon is in full control of all the movements of the robot. And interestingly, I sit in the corner of a room on a console, and I can control several, in fact, all the instruments. So there's a camera that I can adjust with my arm, and 3 instruments. And those instruments allow me to perform these really complex surgeries.
So the doctors... So are the doctors actually working alongside the robot? Are you moving their arms?
Right.
So like, are the two of you?
It's a team.
It's a team. You're okay.
So there's about 10 people in the room. There's an anesthesiologist who's in charge of putting the patient to sleep. There are a number of nurses in the room. We have a bedside assistant. So typically I have a nurse or a very experienced resident, a surgical resident, at the bedside right next to the patient. They pass in instruments, they change the instruments, and then I'm in the corner of the room on a console controlling all of the movements of the robotic instruments.
And I know that if you go online, you can just get a picture. You can't actually, you're not going to see a surgery, but I know I have seen a picture of it, and it
Sure.
still seems complicated.
Actually, you can pull them up on YouTube.
Sure.
Oh, can you
Yeah,
really?
you can pull almost anything up on YouTube,
Oh.
but you can see them.
So
yes.
if patients want to watch a full-length surgery, it's like Denise said, it's all on YouTube. But most people don't want to see that. It's
yeah,
a little bit.
yeah. You want to be asleep during
A
them.
little bit, too in detail. But they're so sure they can see that. But that's really the premise of the. And so why is it important? Why are we doing robotic surgery? There should be a couple of benefits as opposed to open traditional surgery, and there are. And the benefits are these: the smaller incisions. That's one of the benefits of robotic surgery. Less bleeding, in particular for prostatectomies, there certainly is less bleeding. Better precision. So we're able to spare certain nerves and tissue that's very difficult to do through open surgery. And then do the surgery with these benefits. So those are all the important benefits of robotic surgery.
So now, why do they call it Da Vinci? I think of
Sure.
Da Vinci. I think of an artist. I
So
think
you
of
got- you're
I think of
exactly right.
I think of one of our galleries.
So the and I didn't know this until about a year ago, but the company that really is the big force in the robotic surgery is called Intuitive, and so they named the robot the Da Vinci robot, and it's named after recognition for Leonardo da Vinci, which was a painter, philosopher, and about 500 years ago, and he developed the first robot back in the 1400s.
Who knew that?
Right.
Well, that's a
So that is actually named after him.
okay. And so, what are the benefits then for the patients and the family? I know you're the patient advocate, so. I mean, so is it a quicker surgery? I mean,
It depends, of course it depends who's doing the surgery. Somebody who has a less experience, it takes longer, but typically the hospital stay tends to be shorter. We're discharging patients routinely the day after surgery. Whereas in the past, we would keep them in the hospital for 3, 4, 5 days. So hospital time is certainly shorter. The pain is better or limited after robotic surgery. Those are two big reasons or benefits to this type of approach. Nobody wants to have surgery in the first place, and if they do, they want to be out of the hospital quickly and in not much pain. And those are really the big benefits.
and I guess if you're going home sooner, that means your food might be better. You can get a home cooked meal.
Right, exactly.
That's funny. So only because I asked this question, because I know 2 weeks ago we had another physician we were talking more about radiation.
Yes.
So when is surgery necessary?
Yeah, that's in fact a complicated question. There are different ways to treat prostate cancer. For example, it's not only surgery. Sometimes radiation is in fact a better choice compared to surgery. Sometimes we need both surgery and radiation, including other treatments. So, in fact, it becomes a complicated algorithm that we go over in the office, and there's so many variables. The patient age, their previous surgeries, their life expectancy, their the type of cancer they have. These are all things that we have to look at carefully and plan. So it becomes complicated, in fact, and sometimes we have to work through all these variables to come up with the best solution.
Can the family member make the appointment? Can the family member come to the appointment? And
I'll let Denise answer this because
Absolutely.
this is where she really helps with
Absolutely.
our
We encourage family members to take a part in their health. A lot of times the family takes over because the patient doesn't understand. And one of the children have to become involved. And we need them. We need them to take place. So I always encourage the more family members that can come to the consults, the better they can help make that decision what is best for that patient. Because like Dr. Rutkowski says, there are a lot of variables. It's not always an easy answer. But it's good to have choices as well. It's not always, it's good when you have choices, but you have to sift through all the information and find out what's best for that individual. So
I think it's so important for the family member to come to that meeting. You know, when I see the wife there with the patient, you know, that I know right away that, you know, now there are two ears listening on the problem, and we know even from studies that men who are accompanied by their wives, they tend to do better in terms of you know, their surgery, their outcomes, their planning. You know, family really gets in, when they get involved, that leads to good outcomes.
Also, I'd like to add that if they're not in town and they're not available to come to those consults, we'll allow them to have them on the phone for conference. We encourage that as well, and that works out wonderfully.
Yeah.
And I'm sure that if they wanted, if their clergy member wanted to come with them and say a prayer before the meeting, and
we've
have
had
a prayer before surgery.
Absolutely.
Yeah, that's we have that actually routinely. I think it's great. I think you know, when I come out to the waiting room and I see, you know, a number of family members out in the waiting room, it's, you know, that patient's well cared for, and
it's joy.
And typically we get a lot of
does.
hugs, and it's really a great
Hugs
feeling.
Oh, absolutely.
I
we
believe,
like to see that.
I believe in the power of prayer and the power of hugs.
Absolutely.
Yes, they're both
Yes.
good. What if someone has a question? Can they call the office?
Sure.
And what
the
number?
patient advocate gives our cell phone out, so they have our cell phone 24/7. They can call at any time.
But one of our listeners, what number would they call?
Oh, for our office, for the urology office, that is 844
716?
716-844-5000. 5000.
I'm going to have you say it one more time.
Sure.
716-844-5000.
And I'd just like to add that Denise and there are a number of other nurses that are in our group, that they do a lot of the work behind the scenes that allow for my job to be so much easier. So they're there for not only the patients but their families. There's always questions, and the patients can call back to the office anytime. And Denise and her staff really, I get so many compliments from the patients and their families. So they do a terrific job.
Well, we work together as a team because I will say that the doctors are just as great. We can text them, and if a patient or a family member needs to be called, I'll text him and he'll call right away. So all around, it works out great.
And
I love working with them.
And I have been in the office before. It's very comfortable, and they're those little chocolate bars.
They all love
when you
candy.
sign it, at the
We have
desk.
diabetic candy too.
Oh, that's
so.
true. You do have. Okay. Well, then why is robotic surgery better than other surgery? Because I know people who have had prostate cancer and surgery from years ago, and trust me, there's a picture in my mind that it's right there. So why is this surgery?
You know, that's a good question. Robotic surgery is not always the appropriate surgery.
Okay.
You know, sometimes the traditional open surgery is the better way to go. But I'll tell you that about 80% of the time, specifically for prostate cancer, even more, probably about 95% of my prostatectomies are done robotically, and for those advantages that we mentioned before. Now, some of the older urologists who trained, and they've become very good at open surgery, and there's certainly nothing wrong with that, as long as they do a good job, and they typically do. So it's not always the right surgery, the right approach, but a lot of times it is. And if it is, then there are certain clear benefits for the patient, and that's what we're after.
Okay. Now, how many years have you been practicing on the robot?
I was reading this question last night, and I was counting the years, and
They go by fast.
I feel like I started yesterday, but it's been over 6 years now since I've been on my training on my own, and then before that it was 5 years of residency, and then 1 year at the Cleveland Clinic. So I've been doing this for a while now, in hundreds of cases, and so. So it's been a while. I can't believe it's been so long.
Now, is it the surgery right there at the center, or is it one of the hospitals?
No, it's at one of the local hospitals, and the hospital sites are Buffalo General, Suburban has several.
Millard Fillmore
Suburban in Amherst, great hospital. In fact, they do the most robotic surgeries in Western New York. They just purchased their third robotic machine, so they're expanding, and so that's where I do the majority of my surgeries.
That's great. And is a patient advocate there, or the patient advocate is only at the office?
No, we don't go to the hospital. We're at office-based.
Okay.
Absolutely. We're at all 3 offices.
And if you have, but if someone has a question during surgery, they can call you at the
they'll
office.
call before, they'll call after. Absolutely.
Okay.
And we're there for them all the way.
Now, what's the likelihood that the surgery cures a cancer? Does it slow it down
Sure,
for quality of life?
Yeah, that is also dependent on the aggressiveness of the cancer.
Mm-hmm.
You know, as I tell all my patients, not all prostate cancer is the same. We put them into risk categories. There are some that are very low risk and have an excellent chance of cure with surgery. And then there's a lot of in the gray zone, intermediate risk, which, again, surgery has a very good chance of curing. And then there are some really high-risk cancers which may need multimodal treatments, such as surgery, radiation, and other treatments. So it really depends, and that's, again, a much more complicated question based on all those risk factors.
Are there any side effects from robotic surgery?
I wish there were not, but with any surgery, there are risks. And again, the most important thing is who's doing the surgery. You know, are they experienced? How many they've done? What are their outcomes? And actually, patients sometimes forget to ask that question, and it's the most important question. But there are some risks. There are worsening of erections when it comes to prostatectomy, and there are a few things that we do to try to limit that. There's a catheter that's required for about 1 week after the surgery, and then while the patient is recovering, there are some urinary control issues which are temporary. But so those are the 2 big quality of life issues. And then when it comes to surgery in general, there are, of course, potential risks, but those are rare.
Mm-hmm. And again, back to the patient advocate, when you have those questions, I'm sure Denise you can answer a lot of the questions.
You have to be patient, very patient. It takes a while to heal and slow. Everyone heals at a different rate, and
is there like an average length of healing, like 2 months, 3 months?
You know, that's not. The patients for this type of surgery, they're several hours after surgery. They're up and walking the hallway, and they typically go home the day after. They do have a catheter for about a week, so the connection between the bladder and urethra heals properly. And then if they're working still, I tell them, listen, you need 4 to 6 weeks off of work. Some of my patients, they try to get back to the office a little bit too quickly, and I know they're back in 2 weeks. And some of them can do that if they're feeling fine, but you have to let your body heal. Yeah.
It's still healing inside, even though you might be healed on the outside. You have to remember it takes a little longer on the inside.
On the inside.
Yep.
Now, another question. Are there certain foods? Because I know you hear about foods and nutrition all the time, but are there certain foods that maybe avoid prostate cancer? Is there such a thing?
Yeah, there really is. There's a lot of research on this as well, and I tell my patients, diet and exercise are just the cornerstone of health in general, and that goes the same with prostate cancer. Yeah, a heart-healthy diet is a prostate-healthy diet. So what you want to do is you want to avoid high-fat foods. You want to avoid animal protein. A lot of red meats is probably not good for you. And so what I recommend to patients is, a diet that's high in plant food, a plant-based diet. The Mediterranean diet is excellent. That's a diet in fish, plant, vegetables, fruits, and less of the processed foods, less saturated fats. Not only good for your heart and body in general, but also for your prostate.
Do you have anything you'd like to add to that?
It's a hard one to follow. It is. We struggle every day. It is.
Well, we have a few minutes left. And is there anything that I didn't cover that you would like to touch on?
Fran, I think that we hit all the main points. For Denise and I, we love to do this. Surgery is so important to me, and especially robotic surgery is becoming more and more of my focus in my work. And I'm just so lucky to have a great team around me and to do what I love.
It's a joy working with Dr. Rutkowski. Patients really, really love him. They call him the man. He's the man. I've heard that so many times. He's a great physician. Bedside manner is awesome. He relates to the patient, or the patients say that he gets down. He can relate to them as far as
He gets down.
he gets down. Face level with them, and they understand what he's talking about, and they trust him, and that's the thing. Trust is important. You have to trust your physician.
Now, and I know because we have a couple minutes, but now how does a patient see you, the patient advocate? Like, do they ask for you, or do you automatically come
We
into
get
the room?
involved when the pathology is positive. We get notified that way. And we'll meet with the patient when they're told, when Dr. Rutkowski actually goes into the room to tell them their pathology is positive.
So you get involved there. You don't call them or anything. You get involved.
We meet
right there.
them face to face, and we stay back afterwards with educational material.
Oh, and Fran, I just would like to add one more thing.
Yes,
and it
of
has to
course.
do with screening for prostate cancer. There's been so much confusion recently over the years, especially over the last 5 years, in terms of screening. And African American men, they're at higher risk for prostate cancer. They really need to be screened. And I know there's certain societies that have, in fact, said screening is not helpful. It turns out they're probably wrong. We're seeing more and more patients come to the office with more advanced cancer, which is something that we really don't want to see. Men aged 50, and if you have a family history of prostate cancer, that has to be earlier. So even 40, 45 years old, come to the office. Well, screening is easy. It's a blood test, a prostate exam, and if it's fine, off you go.
PSA.
And a prostate exam. And so, I think that's just so important, and we're going to realize that more and more.
Okay, anything to...
No, as we have talked on previous shows, we're going to continue with our PSA screenings around the city.
And we have one coming up in the spring. We just don't have a date yet.
They've been so
announce.
successful, and even patients that have been going to their doctors, we found had cancer, which is really amazing. The urologists are the specialists.
Yes.
These guys are slipping through their primary, so it's scary. So, yeah.
Well, Dr. Rutkowski and Denise, I would like to thank both of you for appearing on, being our guests on the Great Lakes Health Program.
Thank you so much
Thank
for
you.
having
Thank you
us.
for the invitation, Fran.
And we have a couple of announcements coming up. I just want to say that this week, any of our listeners who are federal government employees, Kaleida Health will be at the Federal Government Employee Wellness Fair called Get Fit with Feds. And also we have a speaker that'll be talking on cardiac health on the Cattaraugus Indian Reservation. All it takes is a phone call, and we will be there. And that number is 859-8045, 859-8045. In 2 weeks, God be willing, we'll have another exciting program where our guests will be Kaleida Health President and CEO Jody LeMayo, as well as our Senior Vice President of Public Affairs, Mike Hughes. Thank you for listening to the Great Lakes Health Program. I'm your host, Francesca Messiah from Kaleida Health. Bye-bye.